Glad to have you back. Now, the Nigerian Center for Disease Control has confirmed that 110 persons have died of Lassa fever.
Well, the latest situation report released by the agency shows that from January the 1st to March the 4th, 1,181 suspected cases were recorded in 18 states. Now, these states are Edo, Ondo, Bauchi, Nasarawa, Ebonyi, Anambra, Benue, Kogi, Imo, Plateau, Lagos, Taraba, Delta, Osun, Rivers, FCT, Gombe, and Ekiti.
Well, the new situation report showed that 35 new cases have been confirmed in 5 states, with 40 fresh suspected infections in the 18 states affected so far. Now, we have with us in the studio a medical doctor, Joe Onigbinde. Good morning to you, and thank you for joining us.
Good morning. Thank you.
Good morning.
Now, what should be done that is not being done at the moment? Because it's getting out of hand and becoming alarming.
Well, I don't know what has been done so far. Well, I think one of the problems we have with Lassa fever is that you don't have effective vaccines. You don't have yet. I had the Federal Minister for Health saying they are trying to get some vaccines for it. So if you've not gotten vaccines, all these viral infections, they are difficult to control, especially when they come with non-specific symptoms. See, if you pick a disease and you know this disease is characterized by this
particular symptom.
Yeah, it's easier to actually diagnose.
So misdiagnosis could even be a problem.
Yes, where diagnosis is difficult, then the control will be difficult.
But do we have an epidemic already on our hands?
Oh, of course, we have
110 people dying in 2 months.
Yes, we have an epidemic in our hands, and it's very common in West African states.
Yes.
Nigeria, Sierra Leone.
Ghana is already affected,
yes.
Liberia,
yes.
and Guinea.
But I think that by now, Nigeria should have found a way around it, should have found a way around it.
What should we have done? Really?
Well, number one, one of the most important, most crucial things to prevent this is to up our environmental health. If the environment continues to be a problem, this disease will continue to spread.
But how do you up the environmental health, really? Because it seems that enough attention has not been given to general health.
You know, I know that our environmental health is not the best for now. Go around and see slums, see things being dumped here and there, and see people also cultivating animals within
residential areas.
Yeah, residential areas. So these are things that we really stymie efforts to control zoonotic infections such as Lassa fever.
But is this a reflection of the poor state of the nation's health system in general?
Absolutely,
because we're talking about Lassa fever on one hand, then meningitis shows up, monkeypox shows up,
and we are not sure whether cowpox will not come also. You see, this is appalling, and it is sad because I think Nigeria has taken the issue of healthcare in this country with levity. We've not really taken care about the last time we had good healthcare system in Nigeria is almost 20 years ago, and it's very sad.
We just have to talk about those doctors, the 2 doctors that lost their lives in Enugu when this current Lassa fever started, and then their colleagues had to go onto the streets to protest that there is lack of a virology center, not just even in Enugu, but in some other states of the country, really. So how do you fight a good fight, really, if you are not
without diagnosis centers, and apart from that, the hospitals are ill-equipped, you know, and we don't also have the culture of prevention. There is a standard technique that when you are faced with situations like this, you must get yourself ready. In many of these hospitals, we don't have gloves, we don't have kits, you know, personal protective equipment. So these are things that are very crucial to prevent
We're actually discussing this as if, you know, we're assuming that every Nigerian understands what Lassa fever is. And obviously, there's not enough or much. I mean, I don't recall tuning on the radio or even TV and hearing any kind of public enlightenment about Lassa fever. Maybe you want to educate us For those who don't know what Lassa fever is and are wondering what exactly we're talking about, what is Lassa fever? How
yeah,
does
I think you're right.
How does it
we've not done enough advocacy. We've not done enough enlightenment campaign. Lassa fever was first of all diagnosed or copied in Lassa village in Borno State in 1969. It is an acute hemorrhagic, when we talk of hemorrhagic, that is bleeding,
yes.
Infection, just in the mold of Ebola, you know, and it has some it's a zoonotic infection. That means animals tend to spread it, although it can also be spread from human to human, but essentially the primary host is the animal, rats, multi-mammoth rats, especially the type we used to eat in our village in those days, those rats that have many breasts. So it's an RNA, the Lassa virus is the one that transmits. It's an RNA virus, so we don't need to go into all that. So for us to have a control or a grip over this disease, which has come over the years and is almost since 2012, we've always had it, you know, repeatedly. We have to control these animals, these rats, these rodents.
Okay, well, how did we tackle it in 2012? Because eventually, yes, it went away, and we have established that Lassa fever is a recurrent disease. So what was done in the past, or what should be put in place as a measure?
No, I think the problem
to prevent it totally
is we don't sustain efforts. It's when we have acute crisis, like we have crisis like that, we now have, get up, everybody do this, and after that, we just forget about it. Not knowing that we have not done the basic thing. The structures are actually not in place to control this, to have a continuous control over this something. If you just have commando operation because you have problems in Ogun State and then it's over, and then you relax, it will come back.
Let's even talk about the three centers, virology centers that Nigeria has. The one in Irua, Lasuth has one, and another one in Abuja, the national.
Yes.
What exactly is the state of those centers?
Are they well equipped? Yes, I doubt it.
You mentioned that earlier. But do we really have an idea exactly what the situation is with those centers?
Exactly what? The situation?
Yes.
I personally don't know because I am not privy to what is there. But I can guess, like most other things we have in the country, they are not properly equipped.
And then you see wonder why just those three, for a country as big as Nigeria, why can't each state...
Thank you, my sister. Thank you. We should have tens of them, not just three.
Or worst case scenario, since we run this zonal, at least maybe six in the six geopolitical zones.
Okay, well, that's even too small.
In the absence of, it is too small, but maybe it's a good place to start.
In the advent of an emergency, you need to get to the
I would think that every state should have at least 6. Every state.
Every state.
Yes. Well, Nigeria is big, very vast. I mean, if you say you have only 3 in the whole country, before I have a case in Lagos, and the nearest point of contact is Kano. Before you drive to Kano, and you know our roads are not so good. You know our transportation system has, you know, it is sad. So I think by now we should focus our attention on developing our structures, health facilities, and.
The question I tried to ask earlier: is it possible that these multi-mammoth rats are not the only source of infection? Because it's really alarming that these figures are, you know, doubling almost every day now.
Well, scientifically, they are the hosts, they carry it. But you can also spread from human to human. That's if somebody just has contacted a multi-mammoth or something and is harboring this virus, you can transmit it through, you know, through liquids and through the nose breathing. And then also from in the hospitals too, you have nosocomial infections.
Okay.
You transmit if you get it from the patient, or even the doctor himself gives to the something.
Okay.
So these are the ways in which you can transmit it.
So what is the incubation period for it to be able to be...
6 days to 21 days average.
So once a human being contacts it, maybe from the rat, the first host to the first human,
Yes.
does that mean at that point that human being becomes a contagious person?
Becomes infectious.
Infectious.
Yes, becomes infectious.
Wow.
But before it manifests, that's when it becomes symptomatic. It could take up to 21 days. Between 6 to 21 days. That's the period of incubation period.
21 days would be the full-blown.
Yes, it could be after 10 days, could be after some, but at least maximum 6 to 21 days you have symptoms. And the symptoms are not non-specific. It could start by fever, by headache, by myalgia, that's weakness. You think, oh, it's because I went to Shodi yesterday and there was hold up and all that. You wouldn't know.
Or even think it's malaria.
Yes, think it's malaria, it could be anything. And then, but when it advances, now it begins to show itself that when you have hemorrhages from the nose, from the mouth, from all that, and can also go to some very serious some very serious manifestations like encephalitis, you know,
which is
shaking, and yes,
okay,
blindness.
Okay, from what you just told us, that it seems that it's going to be very difficult to manage this, and then
it's not very difficult,
because if you just told us that from the point of contacting it from a rat, that human being becomes infectious. The person could decide to travel from Lagos to another state and just distributes it, and it takes days before it starts getting the symptomatic effect of the Lassa virus.
Yeah.
So, and that is not a cause for worry. Don't you think maybe that is what is even causing it?
Oh, possibly. Possibly, absolutely. That's one of the problems. That's the problem we also have with other infections in that mode, like Ebola.
So how can health practitioners, I'm trying to wrap my head around how to effectively tackle this, because if that happens, what should be the first thing that someone should look out for, since the person is not even going to feel any form of body weakness the first 4 or 5 days or thereabout?
You could not feel
at the initial
stage of it, might not see any symptoms.
Yes.
So how do you know
yes,
that
the problem,
you need to go
that's
check
why we have to, first of all, you say prevention is always better and cheaper than cure. So that is why we have to be careful not to even contact it at all. As by
of course, we've heard about, ensuring that your foodstuff at home is properly sealed and all of that. Yes. Let's take it back to the government's response, so both at the federal, state and local government. Fumigation, for example. Of course, we used to have environmental sanitation.
Sanitation,
yes.
Wole in those days.
Wole. Do we still have those?
I doubt
now?
it.
Yeah,
I have advocated it here several times, that we might need to go back to those days when you have people going to sanitary inspectors.
So until the sanitary inspectors come back, if they do come back, what do we do then? As individuals, as communities, and what have you? As a nation.
Yes. Let's start from the individuals.
Yeah.
Like you just pointed out, we have to up our personal hygiene, take good care of our foodstuff, avoid having dirty environment where these rats can come in.
When you say take care of your foodstuff, when you go to the market, the Mile 12 market, for example, you and I know the state of that market.
Yes.
It's almost like it's impossible to do something about that market.
Yes.
I go there, buy my half pint of gari or beans or whatever.
Yes.
It's already exposed from the market. And I get home and I seal it, carry out all the
you already sealed
measures.
Sealed infection. That's where we are going to say. We just starting from our individuals now. Now go to the states. Now go to everybody must be up and doing. Because even if you take care of your own environment, your neighbor is not
because you're interconnected.
No, there's no way you can escape it. So everybody's hand has to be on deck. So from individuals to communities to the state governments to federal government. The other time I had Lagos State was trying to kill all the rats in Lagos. That's it's laughable. It's not. But
why is that not effective?
how many rats will you kill? If as you kill, if the environment is not clean, they will come back. I give an example of my
Are you saying that fumigation is not
fumigation
effective?
Could be effective.
Okay.
Fumigation could be effective, but you talk about you fumigate an environment. You can't fumigate the whole street.
Exactly. And from what you just told us, that we just made sense of how Lassa fever works. Yeah. Even if you fumigate the entire state,
yes,
someone could come in from another
state.
Another
state come and reinfect. That's why everybody must be up and doing. For us to actually effectively control this.
What does this seem really that the government is up and doing on this one?
I don't want to be political, but I think we still need to we still have a long way to go where health is involved and environmental health is involved.
Well, we do hear that there's some collaboration between the NCDC and the World Health Organization. Sure. That would go a long way in tackling this challenge. How much data
can be done?
Yes. How much data do we even have to, ascertain clearly the disease burden in the urban area or the rural area, so that government actually knows how to, tackle this disease?
Data base is it's almost nothing to go.
Or non-existent?
It's existing, but it's not good enough. We only know that in West Africa, generally we have about 100,000 to 500,000 cases of this every year. But when it comes to individual states, countries, and so on, we still have to do something about data. Well,
the National Bureau of Statistics is trying to get some data together. Now, but let's go back to the collaboration between NCDC and then WHO. It seems that every time there is an epidemic in the country, that it is our safety pool. Nigeria doesn't have, or doesn't even spend money on scientific research. Should that be given attention? Yes, we know that the health sector is not even getting attention in the first place, let alone, spending a lot of money on scientific research that will, of course, has the potential of not just helping your country, but neighboring countries as well, as the big brother of Africa, anyway.
Yeah, big brother, the sleeping giant of Africa. You said it all. You said it all. We are not focusing on research. And without research, you see all developed countries that these our leaders run to, they started from somewhere. And we have enough fund with this country to do, but in this country, it appears as if our own priority is not health.
If we were to do research, well, I don't want to believe that the NCDC is not doing some research at some level.
They will.
Is there a place for traditional or alternative medicine?
Of course.
Worldwide. Are we even looking at that at all to see how we can tackle not only Lassa but other diseases that we
I believe there's a body, I've forgotten it right now, that is trying to cooperate with this all these alternative practitioners. Yes. Some of them are actually doing some good research, but the problem we have is that most of the things are not really funded. They are individual efforts, and I think the government has to do more on that area to bring them in, because I tell you, a lot of these things that we even take tablets and so on, they are from roots, from herbs. So I watched a movie some time ago, some 3 years ago, when some doctors from Europe actually came to Cameroon to look for certain roots to combat cancer. So it shows that, you see, there's something to call pharmacognosy. That's where you compound drugs and so on. They are mainly from herbs and roots. So I think our government needs to do something more, better, to incorporate these people.
It seems that it bogs down to getting support from government. Recall that in time past, there were some scientists in the country that said they discovered the cure for this or that, and even Nigerians ridiculed them in public, and didn't give their notion a second look. So
we don't seem to have confidence in our...
Confidence, exactly, that's what I was about to say. Really.
In a way, we don't seem to have confidence in them because of some of these way some of these guys said they detected something are not really scientific. So what the government will do is to collaborate with them, help them refine some of these things, fund these things, and then make it more scientific. I remember in the days of when HIV just came on board, Abalaka and the others said they had cure for it, they had cure for it, and it was a kind of something shrouded in secrecy. Yeah. And then when it was time, I was actually involved in the campaign at that time. Abalaka and a few of us were asked to come and debate at Abuja. Some pharmaceutical association organized that debate, and he just chickened out. He didn't come on. Because the technique
Do we know why? Because, I mean, for a long time, Abalaka, would put it out there that his life was at risk, and so he would not readily
that is another thing. I don't know. Well, I wouldn't say no, because you know the type of country we stay in. They think that he has a lot of money, a lot of donation from international organization, so they may threaten him. Like as I speak with you, sometime I was here, I think it was on Lassa fever. Yeah. A whole week I was here about 4 or 5 times. Do you know that they almost kidnapped me? They thought as you guys invite me here, you give me money. So they say, oh, that Baba is a millionaire. So as I got home around 4 o'clock this evening, somebody else now called me, pretending to be another program director in another television station, that I should come, that he's listening to, I think it was on Lassa fever too, that I should come to their station, that he was in TVC, but he has left TVC, and he was pretending to be the guy who directs The Big Issue. Say he remembered that he has interviewed me on The Big Issue on Ebola and something. So he would like me to come and talk about Lassa fever. Luckily for me, one of your guys here too came visiting. And I said, oh, Doc, thank you very much for coming today. And I told him that, in fact, somebody who had been with you, who is now somewhere else, wants me to come again this night, that I'm so tired. He said, who was that? And I mentioned, he now called the original person. That person, no, I've never got in touch. And I said, maybe it's so, let's call. So we now discovered that somebody who was just pretending to. You see, it is possible Abalaka life might have been under threat. But what we say is that even if it's not doing well enough, let us come around.
So is that some kind of conspiracy to oppress and suppress the, success of traditional alternative medicine in Nigeria?
I don't think so.
Or even by extension in Africa?
I don't think so.
Okay.
I don't think so.
Because there have been some conspiracy theories out there.
Okay, yes, I know what you're talking about. But personally, I'm talking about my personal something. You see, well, if they truly have made breakthrough, there is a channel that you have to pass through. There will be multi-billionaires today. But most of the times, many of these things are not actually consummated. They are not, the plants are not, and they are shrouded. I put this one, So how did you put it? There's ways.
So Nigerians are left to rely on the agbo seller, the motor park.
But there's some that are even modernized now. We have.
There are many of them, not even some, many of them across the countries. But as we move forward, so we don't lose sight of the Lassa fever discussion because of time. What should the government be doing now? 110 people are dead. And there are fears that that figure could rise.
The government must be up and doing. We must stand with this vaccine, that we must look for it, number one. Number two, our environmental health must be picked, must be addressed seriously. Number three, the individuals too should be encouraged. And then, like we were talking about, you don't have enough publicity about this thing. No. We must cultivate the community about the importance, dangers of Lassa fever. I think it is important, absolutely.
Okay, so public health centers, you think they would help if?
Oh, of course, public center. This is public health issue. Public health centers are not. You see, if you go outside, it is not only government. Some individuals even know more than some practitioners, because the information is out there for everybody. So public health must be up and doing. Government must support them, and then this television, radio, jingles every now and then.
Public health information, both for the citizenry and,
yes.
of course, the health practitioners themselves.
Yes.
Because from 1969, when this broke out,
yes.
two missionary nurses were the first victims. And
yes.
to date, health officials are still
sad.
victims.
It's because we don't have enough of this. Yeah. We don't have PEP, and then we are not practicing the infection control.
What's PEP?
Personal protective equipment.
Okay.
PPE.
That's PPE.
Yes.
All right.
Yes, protective equipment.
Dr. Joseph Onigbinde, thank you very much for joining us on TVC Breakfast this morning, talking about Lassa fever and what government can do, and of course, individuals and the rest of the community. Thank you so much for joining us.
Thank you for having me. God bless you.
Sure.
All right, we'll go on a short break now, and when we return, we'll be looking at the huge amount Nigeria is spending on subsidy that we were initially told had been stopped. Has it been budgeted for? Was it even budgeted for in the past? We'll talk about it. Stay with us.